Hello, Salem, and welcome to CC Media Presents Our Community Matters. I'm your host, Clark Hilton. We're glad you're here. Fentanyl overdoses are skyrocketing in the United States, and Oregon is not immune. In a recent Salem Reporter article, Oregon Senate Minority Leader Tim Knopp said, "Fentanyl has been a significant game changer as it relates to the world of street drugs, and it is deadly and disastrous for Oregonians." Government entities are working to combat this lethal drug, as Oregon had the largest year-to-year increase of fentanyl deaths in the country for 2023. Marion County is also getting hit hard with overdoses, and unfortunately, fentanyl is easily getting into the hands of our kids right now. Because it is so deadly, can't be detected, and is often mixed into other drugs, one time taking the substance can easily be the last, and the victim wouldn't even know they had it. There is a lot to unpack, so we have invited Diana Dickey to join us. Diana serves as the Drug Education and Prevention Program Coordinator at Marion County Public Health. She has years of experience working on initiatives to prevent youth alcohol, tobacco, and drug use. Our goal today is to bring greater awareness of fentanyl, more knowledge on what adults and parents need to know, and what kids need to do to protect themselves. Diana, it is great to have you with us today.
Great. Thank you for having me.
Absolutely. We're going to jump right into this. Pharmaceutical fentanyl. It's been around for decades. It's a synthetic opioid approved by the Food and Drug Administration for severe pain like late-stage cancer or following surgery. However, illegally made or counterfeit fentanyl is something very different, and it's what's out on the street in increasing numbers. What is this stuff?
Sure. So unlike, say, morphine that's derived from the opium poppy, fentanyl is synthetic, meaning it's made in a lab. So illicit fentanyl is the black market version of the drug, made in garages, basement, hidden settings. And because it's made in a lab, it's cheap, it's quick, it's easy for those who are making illicit drugs to manufacture the fentanyl. And so what's happening is they're taking the fentanyl that they make in their basements and garages and hidden settings, and pressing them into pills that look like prescription opioids such as Vicodin or OxyContin. So and because of that, also because it's the black market version, it's unregulated, so there's no quality control. So someone might get a pill and it might be completely fentanyl, and they would have no way of knowing it was in there.
So when I was growing up, date myself here a little bit, we had the usual street drugs. I think the thing that was used to scare us was PCP or angel dust, but this is a whole other kind of scary. Let's talk about why fentanyl is so deadly.
Sure. So for one thing, it's about 50 to 100 times stronger than morphine. So it's very, very strong. It only takes about the amount of the size of 2 grains of sand that could be lethal for the average person to overdose. So that's one thing. And so when it's mixed into these pills, the illicit pills, it could be anywhere in the pill and you wouldn't know it. You can't taste it, you can't smell it. It's just in there. And again, they're doing this because it's cheap, easy to make, and they make money by selling it on the street. So it takes a lot less fentanyl to have the same effect as, say, morphine or someone who's trying to access heroin. Again, it just takes the size of 2 grains of sand that can cause a lethal overdose for the average person.
2 grains of sand, you would barely even see that if you held it on your finger.
Right.
So drug dealing is about making a profit. My question would be, why are they risking killing their customers? Why is fentanyl even getting mixed in with other drugs?
Sure. So it takes very little fentanyl to create an intense high. So, and the high that comes on very quickly and wears off very quickly. So someone who is seeking it, if they don't overdose, they will go back again to get it. Seek their, they may know it's fentanyl, they may not know it's fentanyl. So it is very profitable for those that are making it and selling it. And something I always tell students when I'm talking to them, they don't care if their customers, are risking their lives. They don't care that their customers are risking their lives. They're only in it to make money. So I always tell students, they don't care about me, they don't care about you. It's all just about them making money.
Yeah, wow. So this is obviously a growing crisis, not just here in our local area, but it's exploding across the United States. I mean, it's not a curve, it's a straight
Yes.
line up.
Yes.
Why?
So it's relatively cheap to make. There's a large supply. At one point, drug cartels got involved in the process to help just flood the United States with these pills. And again, with so many people experiencing opioid use disorder, there is a high demand for these pills, and so they just keep coming.
Is fentanyl part of more the opioid crisis then? Because it does seem like this has only been a really big deal for maybe the last 3 or 4 years since COVID. Is that about right?
Right. I think when we look at some of the data on fentanyl overdoses, we weren't really seeing much of any in 2019, and it's just gone up over the last, about 4 or 5 years since then. Again, it's so easy for those that are making these pills illicitly, easy and cheap to make. It's cheaper for them than making, say, a Vicodin that they're then selling on the street. So.
Is this related at all to COVID? I mean, do they have more time to figure some of this stuff out? I mean, it's just, it just has happened so fast.
I don't have an answer for that. I'm not sure, but it seems like it did just come onto the market quickly.
Yeah.
You're right. Yeah.
Yeah. So Salem Reporter ran a story not too long ago that, again, drug overdose fatalities are expected to rise sharply this year due to fentanyl saturation. The Oregon Health Authority says the state is among the highest with rates of illicit drug use and the lowest in access to treatment, which I assume is part of that Measure 110 effect. What kind of statistics do you have for fentanyl-related overdoses in Marion County and Salem?
Sure. So like I said a minute ago, we have seen a sharp increase since 2019. In 2023, Marion County in particular experienced a 310% increase in fentanyl overdoses compared to the previous year. So we're not talking the 4 or 5 years, we're talking about in 1 year, a 310% increase. And so overall, opioid overdoses have been increasing over the past few years. That includes fentanyl. So some of the data I have just for opioid overdose, we know in Salem, 97301, so Central Salem is the highest zip code in the county for people experiencing opioid overdose. A couple of other zip codes, so 97305 in Northeast Salem, 97302 South Salem, and then 97303 Kaiser. Those are our higher concentration of people who are experiencing opioid overdose.
So 97301, basically the downtown area?
Downtown
largely?
and going east just a little ways.
Okay. So let's talk a little bit about what happens when someone gets a hold of fentanyl. What are signs of an overdose?
Sure. So someone experiencing an overdose, they're hard to wake up, so you can't rouse them. They might have slow breathing, maybe making kind of like gurgling sounds or choking sounds in their breathing. Their fingernail or lip coloring might be like blue or not quite the right color. Their skin cold and clammy, and then their pupils will be really small, real pinpoint.
And so how much time would you have to do something if you come across someone like this?
I don't know how much time exactly, but there are some things that people can do if you happen to come across someone who may be experiencing an overdose.
Yeah, let's talk about that. How do you
Sure.
counteract that?
Yeah, so one thing I always tell people to remember, easy to remember, is check, call, stay, and spray. And I'll talk about that. So check is checking the person to see if they're responsive, right? Call 911. Spray Narcan or naloxone, and I'll explain what that is, and then stay with them until help arrives. So that's the basic first aid for someone who may be experiencing an overdose that we have. So, but let me talk a little bit about naloxone or Narcan and what that actually is. So naloxone's the generic name, Narcan is the brand name. People might be familiar with either term. It's actually a medication that can reverse an opioid overdose, including fentanyl. It comes in the form of a nasal spray. So it's basically just a squirt up the nose, and that can counteract someone who's experiencing overdose. So the nice thing about Narcan is that it recently became available over the counter. So anyone can have access to it. A lot of pharmacies carry it. People can purchase it there. There's places where people who qualify can purchase or can get it online for no cost, which is nice. We're starting to see it more available. So most of schools in our county carry Narcan at some level. They may have it in the office. They may have it in the nurse's office. It just depends. Every school's a little bit different on their Narcan policy, but most schools have it on hand. Workplaces are starting to have it on hand. We're starting to see sporting events, concerts, places where people congregate in large groups will have it on hand in their first aid. So it is definitely more available and easy for folks to use. One thing to know about it too is that someone who is not experiencing an overdose but maybe is showing signs, it's likely not going to hurt them if Narcan is administered and maybe their issue is not overdose. The Narcan won't have a negative effect. Another thing to be aware of is Oregon has a Good Samaritan law. So someone who is helping someone who is experiencing overdose by administering Narcan, calling 911, for example, that law protects them from being prosecuted.
Okay. Is one administration of this medication okay, or do you need to do more with someone?
It depends. Sometimes it takes two, and Narcan comes in a 2-pack. By the way, usually it's sold in a box that's a 2-pack. So sometimes it takes more than one spray of it to do that. It's also important if somebody is experiencing overdose and Narcan is administered to seek medical help after to make sure, because they can go back into overdose. So someone could potentially get a dose of Narcan, seem like they're coming out of it, and go back into overdose.
Wow. To your knowledge, have any of the schools in our area had to administer this, or is this mainly a precaution at this point?
It's, to my knowledge, no. I am aware, last I heard at Salem Kaiser, they have not had to administer during the school day. Maybe they've had other things happening, after hours, things like that. And I don't know about other districts.
Sure.
Yeah.
Okay. So what is Marion County doing to educate the public about fentanyl or to combat the drug?
Sure. So I take every opportunity to talk to folks about fentanyl in any possible way. But I do a number of things just in my role. So I do go out and talk directly to students. So that's one thing. We've done public education, like parent night forums, things like that. We've done press releases. We've done a number of different things. We have right now, we have a Spanish language fentanyl prevention campaign that's online on Spanish language TV. So people may have seen that around. So we do have a lot going on. We have, there's a regional fentanyl prevention campaign called Friends Fight Fentanyl, which is a really great resource. It's designed for teens, and it was designed with teen input, but it is a wealth of information for anyone who wants to learn more. So it talks all about overdose, like we just talked about. It talks about some of the scientific facts about fentanyl. Talks about how you can help someone maybe having an overdose, and other resources so that someone might, if somebody feels like they're experiencing substance use, issues, there are resources that people can reach out to. It also has a number of resources for educators and community partners as well. So that's what I do on my end. So I'm on the prevention side. So we try to be upstream and try to prevent the issue from happening initially, right? So we don't want kids to get a hold of fentanyl, or anyone. Yeah. So we also have at Marion County, we have addictions treatment. And so they're often working with folks who are experiencing substance use disorder. And so they have a number of things that they're doing as well. So they do training for folks on how to use Narcan and get, provide Narcan to certain community partners. They have a program called Prime Plus, where they have certified recovery mentors that will go out. So someone who's experiencing opioid withdrawal or opioid use disorder, and they're in a Marion County hospital, they will go and meet them there to provide resources and support both on site, and then once they're discharged, post-discharge, the clients at Marion County Addiction Treatment, when they're being screened or anywhere in their treatment process, have access to Narcan, so they can have it with them at any time to help, combat an overdose. So, and then they also provide treatment services that, regardless of insurance status, so to make sure that folks have access to treatment when they're experiencing substance use disorder.
Okay. Fentanyl, obviously a growing problem with young people, as we've talked about, who are accidentally ending their lives by unknowingly ingesting the substance. We went and covered the Fight Fentanyl with Facts
Yes.
that the kids from South Salem High School did, and some of the stories that came out of that were just heartbreaking. What do parents need to know about this? Because even myself, as a parent of a 10-year-old, it scares me to death.
Yes. So first of all, parents need to know how kids are accessing these pills, right? So a lot of times what's happening is a young person, they may go online to say like Instagram or Snapchat or something, and they may be seeking out a Vicodin or a Xanax or an Adderall. Some older, like college age students sometimes will think Adderall will help them study better. So, so they will be seeking these pills out online from someone, and then in reality, what they think they're getting it's not the Vicodin or the Adderall or the Xanax. It is actually a pill made with fentanyl. So that's one thing. So parents need to know what their kids are doing online, in particular on apps on their phones. I think that's really, really important. And then also, having conversations with your kids. It's not too early to start, when they're elementary age, in terms of having conversations about drugs. And so, and age appropriate conversations. So for example, with an elementary age student, you can talk about, what is a prescription drug, right? How do you get that? You go to a medical provider, they write you a prescription. How do you read a prescription label on a prescription drug? And then talk about how with a prescription medication, it should only be used by the person who it's prescribed for and following the specific instructions. And so starting there with younger students so that they understand that that's the appropriate use of a prescription drug. Parents of teens or preteens talk about the scientific facts about fentanyl. Talk about some of the, what we just talked about. It's, 100 times stronger than a painkiller that somebody might get in the hospital or something like that. Talk about how, it doesn't take very much to cause a lethal overdose. So having more, those concrete, this is exactly what fentanyl is, and talk to them about, someone might take a pill with fentanyl in it and they might not overdose, but there is no guarantee that the next time they try that's not going to happen. Or it could happen, as you talked about earlier, it could happen the first time you take a pill. And there's really no way of knowing that there's fentanyl in a pill.
Yeah. So kids, they think that they're bulletproof.
Yes.
Especially, what do they need to do to protect themselves?
Sure. Well, first of all, kids need to know that fentanyl is in our community. So it's easy to hear about something and think, oh, that's happening somewhere else. It is in our community. I mean, there's been several seizures from law enforcement of large amounts of fentanyl right here in Salem, right here in Marion County, in the past year or so. Just, lots and lots, they pull somebody over on I-5 and it's a big bag of fentanyl. So kids need to know that it is in our community and it is circulating on the street, that almost every pill that's being sold illegally online, or maybe they have a friend or a classmate or something, it most likely has fentanyl in it, and they should assume that it has fentanyl in it. So that's probably the most important thing. And, as I said, I tell kids, the drug dealers don't care about them. They don't care if people who, take their pills die. They're just in it to make money. So kids in particular need to know that they cannot trust any pill that didn't come directly from a pharmacy. And any prescription pill that they take should be prescribed to them, and they should be taking it exactly how the directions say. Just because you can't, a friend says this is fine, or, I tested it, it's fine, it doesn't have fentanyl, you cannot trust that. So that is the most important message, that, one pill could cause a deadly overdose.
Are you finding that kids are receptive to this message?
I am. I go out, and when I go out into classrooms, and we have these conversations. They have a lot of questions, but they are very receptive. They understand. There's always something new that the drug dealers are trying to get out into the community. So there's something out there right now. It's called rainbow fentanyl. It's been out about a year or so, and so not instead of looking like a opioid or like a OxyContin, it's rainbow colors, right? It looks like the little Smartie candies. And, I show that to kids, and they can tell me right away. They're like, oh, they're making that so that, to make me think that's candy. So they do get it when I talk to them. Really, the main thing is getting that message out there so everybody hears it and understands.
Yeah. Well, before we wrap up today, are there any other things that you think we should know or that you'd like to add?
I mean, I would just say, parents to, talk to your kids. That is really, the one really big thing. If parents can be having those conversations, don't be afraid to have those hard conversations with your kids. I think that's really, really important. And, again, emphasizing for kids, you cannot trust any pill on the street. And that would be for, really anybody, but in particular for kids, because the overdoses, the fentanyl overdoses are the fastest growing in our youth population, because, they're unknowingly getting a hold of these pills.
And about what age is that kind of starting, are you finding?
I mean, I don't know specifically. I've heard of overdoses in 12-year-olds, which seems very young to me. You're talking middle school, 6th grade, 7th grade. That's very young. So that's why, it's not too early to have age-appropriate conversations with your kids so that they understand about prescription medications.
Wow. Well, Diana, thank you so much for joining us today to talk about this. It's a pretty important topic for Salem and Marion County.
Yeah, thank you so much for having me.
Absolutely. While education on illicit fentanyl has lagged behind the speed at which it is sweeping across our communities, hopefully today has helped close that gap a bit. Understanding the danger of this drug is critical to protecting our loved ones. More resources are available at friendsfightfentanyl.com, Diana mentioned that, or in Spanish, es.friendsfightfentanyl.com. You can also learn more about naloxone, the life-saving medication that can reverse an overdose if given in time. It can be administered as a nasal spray by anyone. It's been a heavy topic today, but we thank you for joining us. And remember, our community matters. We'll see you next time.